Role of artificial intelligence in clinical biochemistry laboratory. So what are the contents? Introduction, automation and robotics in laboratory workflow, AI in quality control and error reduction, data analysis and interpretation, integration with big data, cloud computing and IoT, artificial intelligence in point of care testing, AI in laboratory education and training, ethical, legal and regulatory considerations, challenges and limitations, future perspectives, conclusions and references. So starting with the role of AI in clinical biochemistry laboratory. Artificial intelligence is transforming clinical laboratories by enhancing efficiency, accuracy and diagnostic capabilities. AI integrates computer algorithms and machine learning models to analyze complex biochemical data, automate repetitive tasks and assist in clinical decision making. So starting with automation and robotics in laboratory workflow. Sample handling and preparation. AI-controlled robotic systems, they automate pre-analytical steps including sample sorting, centrifugation, aliquoting, and barcode scanning, tracking, and reagent dispensing. Like in sample sorting, it automatically identifies and arranges the patient samples based on the test requirements. And it precisely controls in spin cycles to separate serum and plasma in centrifugation. In aliquoting, these robotic systems, they divide samples into smaller portions for multiple tests or backup storage. And then in barcode scanning and tracking, it ensures traceability of each sample throughout the process. And then there is automated addition of precise reagent volumes for assay preparation. Advantages is that it reduces the human involvement in repetitive and labor-intensive tasks. It minimizes errors due to fatigue, mishandling or mislabeling. It enhances biosafety by reducing manual exposure to biological samples. Automated analyzers with AI integration. AI is embedded in high throughput biochemical analyzers capable of performing 100 to 1000 of tests per day. It measures key biochemical parameters like blood glucose, liver enzymes, kidney function test, electrolytes, lipid profile, hormones. AI functionalities include real-time calibration. That means it automatically adjusts for the reagent drift or machine variation. And then smart reagent usage. It predicts optimal volumes and minimizes wastage. Error flagging. It identifies hemolysis, lipemia or icterus interferences. And predictive maintenance. It alerts technicians before equipment failure occurs. Moving on to the workflow optimization using AI. AI manages the entire analytical workflow by test scheduling. That means it prioritizes urgent or emergency samples and balances routine versus specialized tests based on the daily load. Resource allocation. It assigns instruments, reagents and personnel optimally. It avoids bottlenecks and idle analyzer time. Turnaround time prediction. It estimates and optimizes test completion time per patient or department. Sample routing decisions. It directs samples to appropriate analyzers based on test menu and analyzer capacity. Benefits. It reduces sample waiting time and reporting delays, increases laboratory throughput and patient satisfaction. It enables real-time decision making in high volume or emergency settings. Moving on to advanced data analysis and interpretation. Pattern recognition in biochemical profiles. AI, especially machine learning algorithms, can detect subtle non-linear patterns in complex biochemical datasets. It identifies association between multiple test parameters, for example, glucose-insulin relationship, enzyme cascades, and recognizes disease-specific biochemical signatures even before clinical symptoms appear. For example, a model may detect early-stage non-alcoholic fatty liver disease using mild elevation in ALT, altered triglycerides, and metabolic syndrome markers missed by the standard criteria. Pattern recognition in biochemical profiles. AI, especially machine learning algorithms, can detect subtle non-linear. For example, a model may detect early stage non-alcoholic fatty liver disease using mild elevation in ALT, altered triglycerides, metabolic syndrome markers missed by standard criteria. Advantages is that it enhances diagnostic sensitivity, enables early intervention through detection of preclinical biochemical alterations, and reduces reliance on fixed cutoff values. Multimodal data integration. AI tools can integrate the biochemical data with other data sets. For example, clinical records, radiology and imaging reports, genomic and proteomic data, electronic health records. Use is that these models can help in predicting acute kidney injury by combining biochemical markers, clinical features, and medications. The impact is that it supports precision diagnostics. It enables comprehensive patient profiling for the tailored treatment. Anomaly and outlier detection. AI algorithms like neural networks or decision trees are trained to continuously monitor real-time data from analyzers. It detects outliers such as abnormally high or low results not matching biological plausibility or patient condition. Examples: flagging a spurious potassium elevation due to hemolysis, pseudohyperkalemia, detecting discordant thyroid profiles that may indicate assay interference or pituitary pathology. Benefits is that it reduces false positive and negative, prevents reporting of erroneous results, triggers timely repeat testing or manual review. Trend and longitudinal analysis. AI tracks biochemical changes over time rather than relying on a single result, detects clinical deterioration or improvement. It highlights biochemical drift that may indicate slow disease progression. For example, gradual increase in serum creatinine over 6 months, which is indicative of early CKD. Steady drop in ALT and bilirubin can lead to it can eventually be used for effective hepatitis treatment. Advantages is that facilitates monitoring of chronic diseases, treatment response, and relapse prediction. AI in result validation and interpretation. AI can assist in validating results against patient-specific reference intervals, example pregnancy-specific ranges. It provides interpretive comments on reports like TSH elevated suggests repeat T4 and anti-TPO antibodies, supporting automated differential diagnosis suggestions. Results is that it assists the junior doctors and non-specialists with data-driven insights. Improves reporting consistency and communication between labs and clinicians. Advantages of AI in data analysis. It processes thousands of data points in seconds. It learns and improves over time with more data, that is self-learning. It eliminates subjective interpretation errors. It uncovers non-obvious diagnostic correlations. Moving on towards diagnostic support and predictive analytics. AI-powered clinical decision support system, CDSS. AI algorithms assist clinicians by interpreting biochemical data in clinical context. It acts as a second opinion based on statistical models, disease-specific biochemical thresholds, and historical patient data. How it works? It correlates abnormal values with symptoms, comorbidities, and medication profiles. It suggests potential diagnosis or flags for further investigation. Examples like elevated ALT, low albumin, high INR, it suggests liver dysfunction. Examples are horses, high calcium, high PTH, and low phosphate suggest primary hyperparathyroidism. So the benefits is that it improves diagnostic accuracy, especially for complex and rare disorders. It reduces clinician workload and cognitive bias. It enhances decision-making speed in high-pressure settings. Disease risk prediction. AI models, they predict the likelihood of disease development based on patterns in biochemical and demographic data. It employs predictive modeling techniques like logistic regression, support vector machines, random forest, deep learning network. So examples is predicting diabetes onset using trends in fasting glucose, HbA1c, triglycerides, BMI, estimating cardiovascular disease risk using lipid profiles, highly sensitive CRPs and serum homocysteine, identifying patients at risk for sepsis using lactate, CBC and vitals. Impact is that it enables preventive medicine, targets high-risk populations for early intervention, reduces long-term healthcare costs by minimizing complications. Monitoring disease progression. AI monitors serial biochemical results over time to detect progression or remission of the disease, response or resistance to therapy, use cases like trafficking HbA1c in diabetics or insulin therapy, monitoring CRP, ferritin, interleukin 6 in COVID-19 to assess cytokine storm progression, watching ALT and viral load in hepatitis B treatment to assess antiviral efficacies. Advantages is that it ensures timely adjustments in therapy, it prevents complications through early detection of deterioration, it gives clinicians real-time feedback on treatment effectiveness. Prognostication and outcome prediction. AI combines biochemical markers with patient profiles to predict diagnosis. For example, expected survival, risk of ICU admission, likelihood of recurrence or remission. Example models: SOFA score predictions in ICUs using creatinine, bilirubin and platelet count, cancer outcome prediction using tumor markers and biochemical markers. Clinical benefit is that it helps clinicians and families make informed decisions. It guides resource allocation in critical care settings. Real-time alerts and smart reporting. AI systems can trigger alerts for life-threatening abnormalities, auto-notify physicians via emails or SMS. It highlights critical trends like rising troponin over hours, suggests next best test for clinical action, or it suggests next best test or clinical action. Outcome is it prevents delays in emergency management. It improves patient safety and clinical responsiveness. Following are the examples of diagnostic AI applications in. So benefits of AI in diagnostic support is that there is fast, consistent interpretations, reduces inter-observer variability, it enhances risk stratification and personalized follow-up, it supports less experienced clinicians in complex cases. Quality assurance and control. Real-time quality monitoring with AI. AI continuously monitors data from analyzers and laboratory information systems, that is LIS, to ensure consistency in test performances, precision and accuracy of results, early identification of systemic errors. Real-time surveillance enables instant detection of calibration drifts, tracking of quality control matrices like coefficient of variation, standard deviation, comparison with historical control limits. For example, a sudden rise in controlled standard deviation for serum creatinine alerts the system to recalibrate or rerun controls before patient testing proceeds. AI in internal quality control, IQC. AI-based algorithms analyze daily control run data to identify trends before QC failures occurs. It detects random and systematic errors like best guard rule violations, automatically suggests corrective actions, for example, reagent replacement and recalibration. Benefit is that it reduces human delay in spotting QC issues. It ensures uninterrupted compliance with laboratory accreditation norms, NABL and CAP. AI in external quality assessment and proficiency testing. AI assists in analyzing external quality assurance resulting from national and international programs. It compares lab performance to the peer group. It highlights underperforming analytes or methods. Impact, it promotes continual improvement to ensure lab meets the external regulatory benchmarks. Then comes predictive maintenance of instruments. See, AI models monitor analyzer data logs to detect signs of wear and tear, calibration instability or reagent depletion. It predicts instrument breakdowns before they actually occur. Example, increasing frequency of sample probe errors. It suggests maintenance is needed. Declining lamp intensity in photometric analysis indicates replacement schedule. Benefits is that it minimizes the downtime. It avoids sudden disruptions in critical care testing. Flagging of pre-analytical and post-analytical errors. AI ensures quality across all testing phases. Pre-analytical. It identifies mismatched barcodes or wrong tube types, detect hemolysis, erythrocytemia using photometric checks. It flags insufficient volume and improper transport conditions. Post-analytical. It verifies consistency across reported values, prevents release of implausible combinations, and like glucose is 800 mg per deciliter with normal HbA1c. It adds interpretive notes or alerts for critical values. Standardization and harmonization. AI supports method harmonization across instrument and branches. It ensures uniformity in reference ranges, units, and result formatting. It converts data from different platforms into comparable formats useful in chain labs and hospital networks. Regulatory compliance and documentation. AI ensures that all quality control activities are automatically logged and audited. Reports are time-stamped, traceable, and accessible for inspection. Lab complies with ISO 15189 NABL and other accreditations via continuous digital documentation. Integration with emerging technologies. So, AI plus Internet of Things, that is IoT, in biochemistry labs. IoT enabled devices, smart centrifuges, temperature monitors, reagent storage units transmit real-time data to AI platforms. AI integrates these signals to monitor equipment status remotely. It tracks reagent temperature and expiry continuously. It alerts for anomalies like refrigeration failure, humidity spike. Example, AI detects a drop in reagent fridge temperature and sends an alert before sample spoilage. IoT linked pipette record volume deviations. AI flags recalibration needed. Benefits: it enhances lab automation, it ensures sample and reagent integrity, it reduces the need for constant human surveillance. AI plus big data analytics. Clinical biochemistry generates massive data sets daily. AI-driven big data tools, it extracts the trends from lakhs of patient samples. It supports population-level health studies, example vitamin D deficiency trends. It identifies region-wise disease biomarkers. So it can be used in real-time surveillance of infectious diseases via biochemical markers, national lipid profile analytics for public health policy. Benefits involves promotion of evidence-based public health strategies, and it enables personalized medicine on a population scale. AI plus cloud computing. Biochemical data analyzer outputs and QC logs are stored and processed on cloud platforms. So AI algorithms run on a cloud infrastructure for remote access to test interpretation and reports, centralized monitoring of multi-location labs, real-time collaboration among clinicians, pathologists, and biochemists. Advantages is that it lowers the IT cost and infrastructure burden. It facilitates data sharing in multi-center research and telemedicine. It scales easily with growing data volumes. AI plus blockchain in the laboratory data security. AI integrates with blockchain for tamper-proof record keeping of test reports, QC data, and audit logs. Secured patient data sharing between labs, hospitals, and doctors. Tracking chain of custody in medico-legal summits. Impact is that it ensures data integrity and transparency and security. It reduces malpractice risks and data manipulation. It supports GDPR and HIPAA compliance in the global labs. AI plus digital pathology and omics platforms. AI interfaces digital histopathology. It merges biochemical and morphological data from integrated diagnostics. Genomics and proteomics platforms. AI correlates biochemical abnormalities with gene and protein expression. For example, linking hyperhomocystinemia to MTHFR, that is, linking hyperhomocystinemia to MTHFR gene polymorphisms. Linking hyperhomocystinemia to MTHFR for gene polymorph. Linking hyperhomocystinemia to MTHFR gene polymorphisms. Combining LFTs with liver biopsy image analysis for AI-based fibrosis staging. Benefits is that it enables multi-omics integration. It provides a 360-degree view of patient pathology, advances in prediction and precision diagnostics. AI as point of care testing. Smart POCT devices with embedded AI can provide instant interpretation of biochemical results at the bedside. It recommends clinical actions, insulin dose adjustment for high glucose, synchronized with central lab and LIS in real time. Clinical benefit involves improving care in emergency, rural, and ICU settings. It reduces dependency on centralized laboratories. AI in virtual laboratories and digital training. AI tools create interactive simulations for training students and technicians in biochemical assays, practice troubleshooting, reagent preparation, pivoting errors, learning QC and analyzer operations in safe digital environment. Uses is that virtual electrophoresis and chromatography simulations, AI-powered practical viva training. Benefits of AI integration with emerging technologies. It builds a smart and self-monitoring and adaptive lab ecosystem. It enhances efficiency, traceability, and scalability. It bridges diagnostics with real-time data science and technical evolution. It transforms traditional labs into next-generation digital diagnostic centers. Limitations, challenges, and ethical considerations. Data quality and integrity issues. AI is data hungry. That means its performance relies heavily on accuracy, completeness, and consistency of the input data, correct labeling of the samples, and clinical metadata. So challenges are that incomplete electronic health records or transcription errors can mislead AI predictions. Data entry variability across institutions can limit algorithm generalizability. Errors in labeling, like misclassified disease status, can cause faulty model training. Impact, it reduces the trust in AI decisions. It leads to inaccurate results and patient harm if unchecked. Algorithm bias and lack of standardization. AI may inherit biases from data sets it's trained on. Overrepresentation of one ethnicity, gender, age group, historical clinician decision, reinforcing existing disparities. Examples like AI misclassifies disease risk if trained mostly on urban or Western data. Gender bias in reference ranges can affect interpretation accuracy. Need diverse, standardized, and validated training data sets, transparent model development protocols. Interpretation and explainability. Many AI systems, especially deep learning models, act as black boxes. Clinicians often don't understand how a prediction was made. It makes it difficult to trust and verify in AI-generated insights. Solution approaches is use of explainable AI, that is XAI frameworks that justify predictions with logic, and development of clinician-friendly interfaces showing rationale. Example, ALT high, GGT high, alcoholic liver disease suggestion. Technical and infrastructure constraints. Resource limited setting may face barriers such as lack of high performance computing infrastructure, poor internet connectivity in rural labs, high cost of AI integration in small scale laboratories. Result is that digital divide may widen healthcare inequities, requires phase implementation and government NGO support. Regulatory and legal challenges. Current regulations often lag behind AI development. Key concern is who is responsible for the misdiagnosis, AI vendor or a clinician. How do we certify an AI model as diagnostically valid? What standards should AI-based lab follows? Governing bodies involved, right? CDSCO, FDA, or UMDR, all evolving guidelines for AI in medical diagnostics. And then comes data privacy and security risks. See, AI systems must assess sensitive data, patient data, data privacy and security risk. AI systems must access sensitive patient data, which raises the concern over data leakage or cyber attacks, unauthorized access, and secondary misuse, like insurance discrimination. Solution is that robust encryption, anonymization, and blockchain-based access control. adherence to regulations like HIPAA, GDPR, Indian Digital Personal Data Protection Act. Ethical dilemmas in clinical decision making. AI can suggest diagnosis but not understand emotions and nuances. It cannot replace human empathy in patient counseling. It may recommend aggressive interventions without patient context. Debate is that should AI decide on critical care initiation or do not resuscitate orders? Can AI override a clinical judgment? Consensus is that AI must assist and not replace clinical reasoning. Dependency and de-skilling. Over-reliance on AI may cause erosion of critical thinking in young clinicians or lab staff. It reduces vigilance in validating test results. Recommendation is that AI should be used as a decision support control. AI should be used as a decision support tool, not a decision. Recommendation is AI should be used as a decision support tool and not a decision making authority. Regular human oversight and skill training must continue. Balancing innovation and human oversight. What is the strength of AI? Speed and accuracy in routine data analysis. What it cannot replace: human intuition, experience, and ethical judgment. Strength of AI is it has pattern recognition. It is specialized in pattern recognition across vast data. It cannot replace emotional intelligence and empathy. 24/7 AI provides with unbiased monitoring, but it cannot replace contextual decision making and patient preference. Way forward to ethical AI in biochemistry laboratories. It is a multidisciplinary collaboration between biochemists, data scientists, ethicists, and legal experts. A regular audit of AI systems for performance, bias, and errors. Patient-centered AI design with transparency and accountability. Education and training of lab personnel to understand and monitor AI tools. These are the references. Thank you. Thank you.